Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Jigawa State Government to train thousands of youths in hand-washing techniques to improve the hygiene of communities in the state. The Minister of State for Health, Dr. Lorinimbe Mamora, will be joining us to examine the status of COVID-19 in the country. And Australia's Victoria State reports no locally acquired case for the first time in 3 weeks. The World Health Organization for Africa has referred to the COVID-19 vaccine situation on the continent as a do-or-die on dose sharing. Dr. Mashidisho Mueti, WHO Regional Director for Africa, explains that with vaccine stocks and shipments drying up, the continent's vaccination coverage for the first dose remains stuck at 2% and at about 1% in sub-Saharan Africa. According to her, Africa needs an additional 225 million COVID doses of vaccine to reach the 10% immunity target by September. This is coming as cases on the African continent nears 5 million, and Nigeria records daily cases of COVID-19 with the total confirmed case at 167,025. Let's take a look at the update.
The latest figures from the Nigeria Center for Disease Control (NCDC) shows 45 new infections reported from 6 states in the last 24 hours. Ondo had the highest figures of 23 positive cases. Lagos had 15. Gombe, Kaduna and River State had 2 each, and Nasarawa had 1. No cases were reported in 10 states: Akwa Ibom, Ekiti, Imo, Kano, Ogun, Osun, Oyo, Plateau, Sokoto, and the FCT. The latest figures have raised the total number of confirmed cases to 167,027. 82 additional recoveries have been made in the last 24 hours, increasing the number of discharged patients to 163,413. The report includes 75 community recoveries from the FCT. According to the agency, FCT, Lagos and Ondo account for states with the highest number of cases on admission, while Ogun, Taraba, Sokoto, Cross River and Kogi currently do not have any case on admission. Again, there were no new deaths, which leaves the fatality toll at 2,117. Till date, more than 2 million samples have been tested, while a total of 1,497 cases are still active. In Africa, more than 4.9 million cases and over 133,000 deaths have been reported. According to the Africa Center for Disease Control and Prevention, Nigeria has administered over 2.2 million shots of the first dose of AstraZeneca vaccine to its eligible population. Globally, more than 174 million confirmed cases have been reported, while the death toll has surpassed 3.7 million.
Jigawa State has flagged off the National Youth Volunteer Engagement Program on hand washing and launching of Clean Nigeria campaign for COVID-19 prevention in the country. Under the program, 2,700 youth would be engaged across the 27 local governments in the state.
Jigawa State in northwestern Nigeria has the 6th least number of confirmed COVID-19 cases in the country at just over 500 and has suffered 16 casualties. Since the vaccines arrived in the country, the state joined others to administer them and is currently administering the second dose of the vaccine, an action that is spearheaded by the governor of the state. But it's not satisfied with just administering vaccines, and supported by the federal government, it's promoting non-pharmaceutical prevention measures to reduce the incidence of virus infection.
Please have your seat.
In this event, the state government, in collaboration with the Federal Ministry of Water Resources, is flagging off the National Youth Volunteer Engagement Program on hand washing and launching the Clean Water campaign for COVID-19 prevention.
Part of this one to be very healthy, you have to have enough water. So in other words, from what we discover, this corona, major aspect of what has created or causes the corona is lack of hand washing, lack of hygiene. So this program is programmed by the federal government and then the state government to get at least a volunteer youth, 100 in each of the local government of Nigeria.
UNICEF Water, Sanitation and Hygiene Officer Mrs. Stella Ifoma stresses that the provision of water is significant towards achieving the aim of the program.
UNICEF supported the state in drilling boreholes across the LGAs. Then again, we also train health workers on disease prevention, the health workers. We also train communities on effective hand washing. We call it hygiene promotion. So oftentimes we are monitoring the activities carried out by the various LGA because we have volunteers. We work directly with the wash department of every LGA, and they are being trained on how to engage with the community to make sure that the community understands how to wash their hands with soap, ash or water. That is effective hand washing. Before COVID, we said at critical time, which is before eating, after visiting the toilet, and after handling babies' diapers or feces. But because of COVID, we say at all times.
As efforts are being put in place to prevent the spread of COVID-19 by employing the youths as a vehicle of social change, the state hopes to also improve the hygiene of residents and reduce the incidence of other infectious diseases.
According to the Cross River State government, a huge turnout has been recorded in the administration of the AstraZeneca vaccine since the second phase of vaccinations began. Speaking in Calabar, the Cross River State capital, the State Commissioner for Health, Dr. Betta Edu, reveals that the state government is not relenting in the efforts to ensure those in the hinterlands are covered. She noted that the response to the exercise from Cross Riverians, both at the first and second phase, have been encouraging, despite the limited number of vaccines supplied to the state.
We're presently topping the list for the level of coverage of targeted persons. Cross River State has 117%, which is the #1 on the list now for vaccine coverage. And we're happy that we have made this record. In Cross River State, we didn't have issues of vaccine hesitancy. We even went overboard to give over 60,000 persons vaccines for COVID, and we are presently giving them the second dose of these vaccines. We've had a very great turnout. People have taken the vaccines without issues. In fact, every day we have pressure to continue to give more vaccines to people, but we're unable to do that because we have gone even beyond the 50% limit which we're supposed to vaccinate for first dose.
Now, away from Nigeria, Germany plans to roll out a digital immunity certificate by the end of June, making it easier to prove that a person has been fully vaccinated against the coronavirus. But critics warn the launch date next week, Monday, is too ambitious. Chiponda Chibelu, Deutsche Welle correspondent, joins us now for the latest. Hi, Chip. So is this digital COVID certificate going to work? And also, what are the criticisms surrounding the certificate?
Well, in terms of how it's supposed to work, the COVID Pass, the digital COVID certificate, is supposed to be pretty much a QR code that would be scanned at, an airport or a retailer when you're shopping, or even, the entrance of an event. That would be something that they would be able to scan on your smartphone in an app, and they would be able to see that you've been vaccinated or that you are immune because someone got an infection, from COVID and has recovered within the last 180 days. The people who are allowed to have it are the people who've been vaccinated. So if you have received a full COVID vaccination here in Germany, that would be a one-time vaccination with the J&J vaccine or 2 vaccines with the others. Then 2 weeks afterwards, when immunization kicks in, you would be able to go to a pharmacy or to the doctor where you were vaccinated and get that. Or, of course, for those in the future who, are fully vaccinated, they'll be able to get it immediately upon their second vaccination when they're fully immune.
So there's been some optimism in Germany with its vaccination rollout, and of course there's going to be this digital COVID certificate. But just what does this mean for the government?
Well, obviously, this is a big deal for the government because the way they handle this crisis, the COVID pandemic, is going to be make or break, at least with some voters. And as you know, we come up to the elections here in Germany in September, people will be looking very closely at how the government has been dealing with this issue. And this is exactly why perhaps, at least some observers say, the government is trying to generate as much momentum for itself with news on, obviously, the digital certificate this week, but also, you know, having had a lot of success with the vaccination rollout in recent weeks. And of course, the numbers are falling. And so generally, this is why the government wants to look like it's on top of things.
All right, finally, Chiponda, how will it affect travel in Europe and from outside the continent?
Well, obviously, having this QR code that you could easily, you know, get scanned and, you know, prove that you've been vaccinated and not have to carry a paper document around all the time, which, of course, some people might suspect could have been easily faked, that would make it easy to travel easily across the continent because, of course, you can easily go somewhere without having to take a test to prove that you are immune to the virus. And so this is something that the authorities are hoping will increase summer travel, which is of course the biggest time period for tourism here in Europe. And of course last year the tourism industry missed out because of course there were a lot of lockdown restrictions in a lot of places, and restrictions meaning that people had to take tests to travel, which of course could drive up the cost of getting around. So now the hope is that with solutions like this digital COVID certificate, that people will be able to travel easily and seamlessly like they've always been able to do.
Chiponda Chibelu, Deutsche Welle correspondent there with the latest. Thanks for that update. Now, it's good news for Australians in Victoria State as now new locally acquired COVID-19 cases have been reported for the first time in nearly 3 weeks. It comes as state capital Melbourne comes out of a snap 2-week lockdown after an outbreak that has seen about 90 cases since May 24. We'll hear more on this and other developments on our global COVID-19 update.
Australia's Victoria State reported 0 locally acquired cases of COVID-19 for the first time in nearly 3 weeks on Friday, as the state capital Melbourne came out of a snap 2-week lockdown after an outbreak that has seen about 90 cases since May 24th. Melbourne exited the lockdown on Thursday night, but some restrictions on travel and gathering will remain, including a rule that would force the city's 5 million residents to stay within 25 kilometers of their homes. As India races against time to inoculate its population from the virus, medical teams sometimes have to overcome treacherous terrain in some of the remotest parts of the country to reach the rural population with the help of ponies. In the northern region of Lidawat, more than 100 kilometers from the capital of India-administered Kashmir, medical teams had to trek more than 6 hours on foot and ponies to reach nomadic and shepherd tribes in the mountains. A team of over a dozen healthcare workers carrying medical kits and equipment, including oxygen cylinders, reached Lidawat. European Union countries have agreed to an easing of travel restrictions over summer that will allow fully vaccinated tourists to avoid tests or quarantines and broaden the list of EU regions from which it is safe to travel. Ambassadors from the 27 EU member states approved a modified European Commission proposal that people who had been fully vaccinated for 14 days should be able to travel freely from one EU country to another. Bells toll 600 times at the National Cathedral on a rainy evening in Washington, D.C., once for every 1,000 Americans who have died in the coronavirus pandemic.
The official death toll 15 months into the pandemic is approaching 600,000, even as the national vaccination program has successfully reduced the rate of daily infections and deaths. As of June 9th, the overall death toll in the U.S. is 595,625, according to the Centers for Disease Control and Prevention. The World Health Organization (WHO) puts the international figure at 3,758,560.
And joining us right now is the Honourable Minister of State for Health, Dr. Loronimbe Mamora, to talk about an assessment, to give us an assessment on the fight against COVID-19 in Nigeria. And this is hoping that we have him right now. Very briefly, can you tell us your overall assessment of the impact of the pandemic on the general population? Oh dear. We're going to try and get, of course, the Honourable Minister very shortly on, indeed, an assessment of the impact of COVID-19. But, of course, we're still taking you through what's happening. That is the COVID-19 update situation in the country. And, of course, when you take a look at what the World Health Organization is saying, they're very worried about vaccinations. And Dr. Mashidiso Moeti, who is the regional director, has said that COVID-19 vaccine, the situation on the continent is a do or die on dose sharing. She said that, you know, with vaccine stocks and also shipments that are drying up, the continent's vaccination coverage for the first dose will remain stuck at a certain point. I believe she says 2%, and when it comes to sub-Saharan Africa, it's about 1%. She's also said that an additional 225 million COVID doses need to reach the 10% immunity target, and that is by September. I'm just being told that the Honourable Minister of State for Health has just joined us. Thank you for joining us on the program, Dr. Mamora.
Thank you very much for having me.
All right, just because we have quite a few minutes before we wrap up on the program, but briefly tell us your overall assessment of the impact of the pandemic on the population.
Well, as we have always said, the COVID-19 pandemic has devastated lives and livelihood. No doubt about that. It has affected businesses globally, and so we are not also not out of the loop in terms of the happenings here. But so far, so good in terms of our response activities. You will recall that we started with Presidential Task Force set up by Mr. President, President Muhammadu Buhari. But along the line, just a few weeks back, that transitioned into Presidential Steering Committee. And where we are right now is, happily enough, the cases that we see, and we confirm they have reduced to, just in the last 1 week, less than 20 cases confirmed nationwide. So that means that we're not doing badly. But then it's not yet guru, and that's why we issued the directories we did the other time, that people should not lay down their guards. They should still maintain, particularly the non-pharmaceutical interventions, use of masks, washing of hands, maintaining social distance, avoiding crowd and all that. Because we have moved to the vaccine administration phase, but unfortunately there is shortage of vaccines. And then, so in fact, we are waiting. You recall that since the first time we had the first arrival, which was way back in early March, precisely 5th of March, the vaccines that we received then, barely about 4 million doses, we've not been able to receive additional batch of vaccines. So, but what we have on ground, almost, the first phase, which is giving 50% of the vaccines to our people, that we achieved almost 100% of that, and we are now giving the second dose because we said that it's better for us to have a pool of fully vaccinated Nigerians rather than have vaccinated. So,
but if, Doctor, I just wanted to jump in there. If we're not reaching herd immunity because we don't have adequate vaccines for the necessary population, then, you know, what exactly are we doing?
Well, we're still making efforts in terms of reaching out to the multilateral facility, the COVAX facility, and of course the African vaccine acquisition tax team, which is also helping the member states of the African Union to get the vaccines. Because we will not, of course, our quest to attain herd immunity of about, vaccinating 70% of the eligible Nigerians to be vaccinated. We are looking at that in the year 2022. But where we are now with the vaccine shortage, we are still far from achieving that. But we are hoping that with the efforts and with the hope, with the hope that the Serum Institute of India, which supplied the first batch of vaccines we had, will very soon start shipping vaccines to Nigeria as well. Right. And then we will go on with our quest for vaccinating the number of people to achieve herd immunity.
About infectious variants coming into the country, I know there was a time you put out a circular about some 90 travelers not knowing their whereabouts, but have you been able to locate them?
Well, we have improved our surveillance system and follow-up, and you recall that a few weeks back we had to publish names of those who evaded quarantine and those who even refused to be quarantined and all that. So we are applying sanctions where necessary, and we have improved on the portal in terms of surveillance on those coming in, particularly from those countries of interest, Turkey, Brazil, India, and then following up and then giving and ensuring that they keep to institutionalized quarantine, which is what is needed for people coming from these areas. And of course, we improved the check on the vaccine, the evidence of vaccination from where they're coming from, the evidence of tests that they did, and to ensure that we are not having fake results in our hands. We have a process of checking what is brought to us to confirm that they're really genuine. So these are some of the measures we are putting in place.
Finally, before we let you go, health workers continue to play an important role in the pandemic fight, but there seem to be reports that a lot of healthcare professionals are leaving the country. Are you worried by this?
Well, yes, we are worried, and that's why we are trying to do everything we can to improve their welfare package, and then, of course, ensure that their emoluments are paid as at when due. You recall that we had a meeting just about 2 weeks ago with the health workers, the union, joint health sector unions, and of course the NARD, NMA, and all the workers in the health sector, where we were trying to now beef up the hazard allowance that would be made available to all workers in the health sector. These are some of the measures we are trying to put in place, aside paying for the residency program. That's postgraduate training of doctors. We are paying for this free. The federal government of Nigeria is paying for this free. And that's one of the incentives that we are giving to ensure that they stay in the country.
We'd like to appreciate your time on the show. Wish we had a lot more time. The Minister of State for Health, Dr. Oloronimbe Mamora, thank you for joining us on the program.
Thank you very much for inviting me.
And COVID-19 isn't malaria. Take responsibility to protect others. If you are experiencing symptoms associated with the virus, you can visit our website. Also, channelstv.com gives you a better understanding of the pandemic. All you need to know, several other stories there as well. It's all at your fingertips. That's the program this week. Thank you for watching. I'm Millicent Nwaka. Stay healthy.